Hello and welcome to the overview of Obstetrics and Gynaecology. By the end of this session, you should be able to understand and explain the functions of the department, identify the team players and their respective roles in this department, learn how time can be managed well while training in this department, recognize the roles and responsibilities of a house officer in the Department of Obstetrics and Gynaecology, understand and manage the expectations of being a house officer here, and last but not least, understand the pathway to specialization in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. The term obstetrics is derived from the term obstetricus, which means pertaining to a midwife in Latin, and the word gynecology, which originates from the Greek word gyne, which refers to attached to woman, and logia, that means study. So obstetrics and gynecology is the branch of medicine that specializes in women's health, especially their reproductive health, pregnancy, and childbirth. Most women, although pregnant, are otherwise fit and healthy. Others might have acute or chronic medical problems that may complicate their pregnancy and thus are under specific care of an obstetrician. The main areas under the purview of obstetrics and gynecology are prenatal care and diseases in pregnancy. Prenatal care is important in screening for various complications of pregnancy. This includes routine office visits with physical exams and routine lab tests during the first, second, and third trimester of pregnancy. Fetal assessment and monitoring is also done in prenatal care. The other area covered is diseases in pregnancy such as obstetric emergencies, issues arising in relation to pregnancy, induction in labor, as well as problems arising during the postpartum period. The other arm of this department involves gynecology. So examples of conditions dealt with by a gynecologist are cancers and precancerous diseases of the reproductive organs including ovaries, fallopian tubes, uterus, cervix, vagina and vulva, incontinence of urine, amenorrhea, which is the absence of menstrual periods, dysmenorrhea, infertility, menorrhagia, prolapse of pelvic organs, infections of the vagina, urinary tract infections and pelvic inflammatory disease, premenstrual syndrome, and other vaginal diseases. Among the services that's been provided in this department include the outpatient care, inpatient, and others as well. So as for outpatient care, we have the antenatal, postnatal, and gynecological services. For inpatient care, we have labor and delivery, elective and emergency operations, as well as daycare services, and others which include health education promotion as well as counseling. There are numerous staff and service providers working together in the Department of Obstetrics and Gynaecology to ensure the objectives of the departments are met. It is advisable to be aware of your team, who your team comprises, and what are their respective roles as part of the team. Let's begin with the doctors. The head of department usually holds a post of a consultant. Otherwise, the post can also be held by a surgeon or specialist in training. The head of department runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. The head of department is assigned to ensure that the department runs smoothly. They also play an important role as a representative of the department to important meetings, raise issues to the attention of the hospital director, and manage the department's budget to ensure adequate medications and equipment are available. Next, we have the consultants. The ward consultants lead ward rounds at least once a week. The consultants oversees the patient's diagnosis, investigations and treatment plans, and sometimes troubleshoots difficult problems as well. Next, we have the specialists or the surgeons. They conduct pre-operative and post-operative ward rounds. They lead teams of doctors during the rounds, and their main role is intervention in an operative or a surgical approach, as well as consultation in the doctor's office. New cases which are admitted from the emergency department are reviewed by them, and surgery is then decided based on the emergency of the condition. There are instances where most of the cases are also managed expectantly. Then we have the medical officers. The medical officer in the ward is your one-up who reviews the patient with you before the surgeon or the specialist arrives. The cooperation between the medical officers, the house officers and nurses is essential in ensuring patients receive holistic care during their stay in the ward. In this department, most of the senior medical officers will be able to conduct deliveries as well as perform simple C-section deliveries in the operating theatre. Next, we have the nursing staff. The nursing staff in every department is led by the matron of the department. So the matrons are in charge of the nursing service division and are directly accountable for the proper organization, direction, coordination of nursing services. They provide leadership to professional and direct care to their nursing staff. They are usually dressed in dark blue uniform. Then we have the ward sisters or the clinic sisters. The sisters organize all nursing activities of a unit in accordance with the hospital policy and rules. The sisters also directly supervise patient care of the unit and provides direct care to seriously ill patients as and when a situation arises. She takes care of the well-being of the nursing staff team. She manages and arranges the rosters for the nursing staff team and also helps the nurses carry out their duties if the wards become too busy or overwhelming. She's in charge of ensuring all the records of the patient related to diagnosis, condition and treatment, and ensure proper maintenance of the records. They are usually dressed in light blue. Next, we have the nurses. The nurses here can be divided into the staff nurses, the community nurses, as well as the midwives. So ward nurses provide direct patient care, either bed making, changing of bed sheets, oral care, ensuring the patient is moved, and also involved in administration of medication, charting of vital parameters and observation, and last but not least, conducting deliveries for patients. Next, we have the allied health professionals, who are the pharmacists. Ward pharmacists follow the ward rounds led by the specialist or the consultant, and they provide their consultation on the safety of therapeutics prescribed, alternative drug therapy, double checking on dosages, and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. Then we have clinical assistants and lab assistants. They are involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and maintaining the highest standards of cleanliness throughout. And as for the lab technicians, they assist physicians and specialists in the diagnosis and treatment of diseases by performing tests on tissues, blood, and other body fluids which are dispatched to the lab. So you and your ward team highly depend on these technicians. Having a smooth relationship with them enables communication to work well to ensure specimens that are dispatched to the lab and processed promptly, as well as the results are communicated back to you as per the stipulated time frame. We also have the imagers and the record keepers. The imagers, also known as radiographers, are certified technicians who capture images of organs, bones, and tissue for patient diagnosis. Radiographers are equipped with the technological skills to handle imaging equipment and interpersonal skills necessary for patient care. And then we have the record keepers, who are responsible for the maintenance of medical records. They must safeguard medical records from tampering, loss, or unauthorized use. They are responsible for seeing that the patient's right to privacy and the confidentiality of the information stored within the medical record is maintained at all times. We have the telephone operators. To ordinary people visiting or calling into the hospital, a hospital switchboard operator seems to be doing mundane work. In actuality, these people are wholly responsible for all the communication that goes on in a hospital. And next would be the support crew, which are the housekeepers and linen managers. The role of housekeeping in hospitals is to ensure that all areas, including treatment and surgical rooms, patient rooms, and labs, as well as public areas, are kept clean and sanitized. So you and your ward members depend on the support crews as they keep your ward clean and safe from hazards. You can play your role by ensuring sharps and wastes are discarded well and pose no danger to the housekeepers, Linen managers appreciate your assistance in placing their used linens in their respective bags. How about in the operating theatre? So here you will be meeting the scrub nurse. They scrub in earlier than the doctors or the surgeons to arrange instruments and complete the instruments count with circulating nurses. Circulating nurses receive patients from the ward in the OT airlock. They confirm the patient's details before the patient is pushed into the operating room. They assist in instrument counting with the scrub nurse and note them in the relevant forms. Then we have the recovery nurse. They stand by in the recovery bay to observe post-operative patients. They check the details of the patients again post-operatively. They would then hand over to the ward nurses once the patient is ready to be sent back to the ward. Then we have the in-charge OT nurse. So they usually make sure all elective patients are called in to the OT as per schedule. They write patients' details booked for emergency operation on the emergency op form. And last but not least, you'll also be meeting the anesthesiology team in the operating theatre. They will be dealing with the patient's airways and they will make sure that the patient is optimized pre and during the surgery as well. Now, let's quickly run through a flow of patient admission to the obstetrics and gynecology ward. Patients are admitted to the wards either from the department's outpatient clinic or from the emergency room, or they could be coming from other wards, which is known as periphery wards, or early pregnancy assessment unit, or from the labor room. Patients can also come in from the operating theatre. So from the clinic, the new cases which are referred from other centers or follow-up of existing patients make the bulk of the cases. In clinic, you will be tasked to clock the new cases, do a follow-up review on existing patients' progress, and perform the necessary tests as well as preparations for the delivery, if warranted. Similarly, if they are coming from the emergency room or the early pregnancy assessment unit, here you will still need to clock the patient that has been referred over, conduct relevant physical examinations, as well as carry out the plans that has been documented by the team seen in the emergency center. In the operating theatre, you are responsible to assist the surgeon or specialist in positioning the patient, ensuring that all the medications that have been planned had been administered and the vital signs have all been recorded. Patient's consent form has been filled in. Here you will be assisting the surgeon and you will be documenting the post-surgical notes review. So time management is extremely crucial to reap the maximum benefit of training during housemanship. Let's look at a few general tips on how you could organize your tasks and use your time wisely. Tip number 1 is to create a job list. Here, make a customized table to summarize your what works and your tasks systematically. Prioritize work that needs to be done within office hours. Cross out the task that has been carried out to avoid confusion between your colleagues. And finally, delegate your task among you and your colleagues so that all the tasks are completed within the stipulated time frame. Tip 2. Familiarize with your patients and their surroundings. Allocate about 10 to 15 minutes to review your patients. Remember the important things about your patients and significant results. Check necessary parameters and attachments on your patient. And finally, save the necessary emergency contact information for the day, such as the surgeon or medical officer in charge or on call, as here in Malaysia, we do not have a pager system. The third tip is to take turns with your colleagues if you wish to take a break and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. If you're working in the operating theatre on that particular day, make sure you have your breakfast first, as you may not know how long or if the operation you need to assist may be prolonged. Also, be early to reconfirm your patient's cases which have been scheduled for elective surgery. Write the patient's details on the board, prepare the relevant medications, prepare the template for your op notes to save time in between each operating theatre sessions. Last but not least, the final tip is to use electronic or digital productivity tools which most of you might already have in your daily usage devices such as your smartphone, iPads or digital notepads. Utilizing the reminder, notifications and planner apps or systems can not only save your time but also ensures tasks are completed. Next is to understand the expectations in this department. So you'll have days where you'll be working in a cold operating theatre to assist your surgeon, but you might also need to use more of your energy in assisting your surgeon with certain maneuvers during delivery. Obstetrics and gynecology operations can take long hours depending on the type of surgery, and it gets more complicated intraoperatively. Like the surgical department, your ward rounds will start early as your surgeons will need to prepare for their OT by 8 to 9 a.m. Your duty can start as early as 7 a.m. Therefore, it will be advisable that you come in earlier to review your patients and discuss any problems regarding patients during your ward rounds. Before the rounds begin, for those patients post-operatively that needs to be reviewed, you need to remove the dressing and cover it with a sterile green cloth. Take note of all the plans given by the surgeon so that you will be not missing anything. Bear in mind that in the obstetrics and gynecology department, you learn through errors and mistakes, especially when it comes to assisting the surgeons in the operating theatre. Also know that there are many things that can happen all at once. For example, in the labor room, or there might be 2 to 3 patients who need delivery imminently, but all of a sudden one of them has got an abnormal CTG, and you would then need to immediately prepare the patient for an emergency C-section. So once you have become a doctor, you are expected to act fast, think on your feet, and know as many things as possible required in the department. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it. So how do you go about it? There are 2 pathways for attaining the qualifications as a specialist in obstetrics and gynecology, which is the master's degree program through the Ministry of Education pathway, the MOE-MOH pathway, and the MOH-MRCOG program through the Ministry of Health pathway. The minimum training duration is 4 years and the maximum is 7 years. On the MOE-MOH pathway training is conducted at the university, hospital, or an accredited government healthcare facility. On completion of the Masters in Obstetrics and Gynecology pathway, the trainee is awarded a degree in Master of Obstetrics and Gynecology and Doctor of Obstetrics and Gynecology in UKM. The trainee will then undertake a 6-month period of gazettement and needs to complete 2 years of training to be registered in the National Specialist Registry as a specialist in obstetrics and gynecology. The MOH-MRCOG pathway is a structured program with locked activities performed under supervision with objective assessments by clinical supervisors and designated educational supervisors. The program covers all the modules listed in the national curriculum. It is a trainee-driven pathway which may be undertaken at accredited training hospitals. The examinations are conducted by the Royal College of Obstetricians and Gynecologists. The MOH-MRCOG Parallel Pathway Central Committee at the Medical Development Division of Ministry of Health is responsible for the oversight of the program, progress and examination. So to enter the program, one needs to have completed 2 years of housemanship training, attain full registration with MMC, and have completed the Part 1 MRCOG examination. Then one can proceed by registering with the Medical Training Division MOH and should be set up on an electronic training register. The total duration of training in this program will also span 4 years. This is a list of recognized postgraduate qualifications in Malaysia in obstetrics and gynecology. If you were to search for the recognized postgraduate qualifications in Malaysia in the National Specialist Register, you will learn that the qualifications recognized here in Malaysia largely encompass the local master's program. In the last years of the training program, trainees undertake subspecialty training or advanced training skills modules to develop the high skills they will need for a consultant post in their specialist area of interest. Among the subspecialties which are available include gynecological oncology, maternal and fetal medicine, reproductive medicine, and urogynecology. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while you're training in this department, understanding the roles and responsibilities of a house officer in the Department of Obstetrics and Gynecology, what is expected out of you while you're on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those who are keen to join this field of surgery. There are plenty of online resources available to assist with your learning process while you are here in training as a house officer in the Department of Obstetrics and Gynaecology. You are encouraged to be resourceful as it makes your job easier. Here, we will be going through some useful resources to aid your quest for department-related information and skills training. The Royal College of Obstetricians and Gynecologists is a professional association based in London, United Kingdom. Its members, including people with and without medical degrees, work in the field of obstetrics and gynecology, that is, pregnancy, childbirth, and female sexual and reproductive health. Here, you will gain access to various guidelines, research services, and careers as well as training availabilities. Next would be the College of Obstetricians and Gynecologists from the Academy of Medicine Malaysia, which provides links and guides to fellow doctors in the country to gain an insight into the system should they are interested to pursue further in this field. It also has a compilation of clinical practice guidelines for practitioners' reference. The Obstetrics and Gynecology House Officer Guide is a useful kit developed by doctors from Hospital Ampang to assist house officers learning in the department. It has quick references for normal values and useful tips to assist doctors in the Obstetrics and Gynecology department. Next would be Geeky Medics Obstetrics and Gynecology Note. Geeky Medics provides us with a collection of obstetrics and gynecology OSCE guides, including bimanual vaginal examination, pregnant abdomen examination, and many more. Lastly, we have some YouTube channels from the Graduate Medical Education, which showcases videos which are created by a variety of faculty and fellows from the University of Connecticut. It contains useful information with clear videos to aid learners to excel in this department during their stint. So we have finally come to the end of this session. We hope this session was insightful and thank you very much for your time.